The mission of our group is really to help each other as we try to take care of children and adolescents with headache. Um, our section is comprised of a large group of people. It's primarily child neurologists, pediatricians, advanced practice providers, and psychologists who take care of children and adolescents with headache. So we try to support each other and help each other to understand how best to do that. And so we can learn from each other on clinical cases and collaborate with each other on research projects, just to try to advance the field together. So we've had several recent projects. A couple of the highlights, we put together a paper a couple of years ago with recommendations about the use of some of the newer medications, particularly the CGRP monoclonal antibodies in children and adolescents. The trials of these medications are beginning and ongoing, but inevitably we're asked sometimes to use these medications off-label, and we came together to put our thoughts together and say which are the best candidates for these medications for off-label use. Then in the past couple of years, we've also put together a project called the Pediatric Migraine Action Plan. This is essentially a twist on the migraine action plan that was developed for adults, but then also very intentionally mirrors the asthma action plan. And the reason for that is because we were trying to develop something that would be accessible for patients and helpful in guiding their daily medications, their acute medications, what should be used in a rescue, but also be very useful for school nurses since they're so used to seeing asthma action plans. And so we had a number of people from our section contribute input to try to refine that and make that clearest and most useful for our patients. And then most recently, we put together a transition packet. So children and adolescents who are under our care ultimately eventually grow up and need to transition to adult care. And sometimes we're not quite sure what the best way is to how to hand off those patients, that we ensure all the information we've learned in all those years of interactions can be passed on most clearly. So we put together a transition packet, and we worked very hard to make it something that was useful and feasible for the clinician, but then also be implemented broadly. So moving forward for the future, there's a couple of main things that we're really focusing on. So the first is branching out of what we talked about with the Pediatric Migraine Action Plan, of really focusing on awareness of migraine and headache in schools. Despite the very high prevalence of migraine and the tremendous disability that it causes, it doesn't get a lot of attention in schools. And we often hear from our patients that they don't want to raise their hand and say they have a migraine and need to go get medications at the nurse's office. And so there's a lot of one-on-one advocacy with patients, but we're also trying to think about how can we move that advocacy along to a much larger scale so that we can reduce the barriers and reduce the stigma for our patients. In parallel, we are also trying again to really just support each other to move the field forward. So many therapies were recently approved were FDA approved for use in adults. So we're now seeing a huge number of pediatric trials that are all coming, which is tremendous, and it gives us such opportunities to help our patients. But so we're trying to essentially figure out together how can we best do this, and how can we help our patients enroll them in trials, and really give both that individual an opportunity, but also then hopefully change the options for our patients for the future.